So I am Hillary O'Toole. I'm the executive director of BCMAC. I'm also a Center Township resident and very invested in all of this project work that we're doing with the air monitors because one of my children actually has asthma. I really want to thank EHP for all of the work that they've been doing. These quarterly reports are just phenomenal. We're really excited to see the key findings and all of the data kind of simplified in multiple different ways. And so I really am just very excited to welcome an expert from the Environmental Health Project, which is an organization that's dedicated to protecting public health from the impacts of shale gas development. They'll be going over the key findings, like I said, and from our first quarterly report from the AirSense project, or excuse me, from the second, which is specific to Beaver County. And joining us today is Aaron Makatura. He's the project manager for Appalachia at EHP. He works directly with local communities such as ours, helping us understand the health risks of shale gas development and empowering them with knowledge and resources. I am very grateful to have Aaron here today so that he can share all of his insights with us. So welcome, Aaron, and take it away.
Hi, all. As Hillary said, I'm the project coordinator for Environmental Health Project, and I am here to just go through some of our findings. I just want to make sure I was confirmed this beforehand, but can everyone see my screen and see the presentation? Awesome.
All good.
All all right. As Hillary said, we are going to go over the AirSense Community Monitoring Project for the second quarterly results. These are going to reflect the results from March of this year, picking up right where we left off and going through the 1st of June. So, all right. Tonight we're going to follow a similar agenda. If you guys were here about 3 months ago, where I'm going to deliver a little bit of background from Environmental Health Project, then go through what the AirSense project is and where we're kind of pulling all these numbers from, where we got this information from, and then also going over the results themselves, and then just some quick protecting your health information, as well as um, some question, and then we'll finish up with a question and answer session. But if anything does come up, feel free, Hillary's, if you want to just call out anything that might come up um, for anyone that might have any questions in the moment. So, all right. So, an introduction to EHP. As Hillary said, EHP is a public health nonprofit organization that defends public health in the face of shale gas development. It was founded in Washington County in 2012. And one of the things that we do, as you can see across the country, is we have program areas that focus on data collection and analysis, health and wellness education, and policy and advocacy initiatives in order to support organizations and community members um, in the face of shale gas development. One of our partners that we're proud to be partnering with for projects such as this is BCMAC. And one of the things that you might hear about in the future, if you are local to Allegheny County, is the Health Watch program that we have, where we are able to put up slightly smaller monitors in order to help people understand the impacts that local development might be having on their health. All right. As I said, I'm gonna touch upon the AirSense project overview. So the goal of this project was to give Beaver County community members access to real-time air quality information and resources in order to take actions to mitigate any health risks that might be because of air pollution that is happening in the region. The air monitoring technology that is being utilized during this project is going to be 5 high-quality stationary air quality monitors that are Aeroqual brand. They are AQ65s, and they are going to be testing for PM 2.5 or fine particulate matter, NO2 or nitrogen dioxide, ozone, and then VOCs. Additionally, there is a mobile monitor that BCMAC can talk more about that has tested for 1,3-butadiene, and I believe that there are other VOCs that are going to be that are being tested for at this time, but they can talk more about that. The other part of this is going to be community education, which includes a website that has real-time air quality data from the monitors that we're going to be talking about tonight, as well as resources to protect your health from air pollution, which are going to be some of the things that we're going to cover before, as well as health monitoring, which I believe is going to be launching during the summer from BCMAC and partners at the University of Pittsburgh. For the stationary monitoring, as I said, for this report, the monitoring period is going to be from March of this year until June of this year, and they're going to be using AirQual AQM65 monitors that continuously monitor for 4 different pollutants that are going to be fine particulate matter, nitrogen oxides, ozone, and then volatile organic compounds, or VOCs. We have quarterly data reports that will be available from BCMAC, as well as key findings that have been written by Environmental Health Project, and then quarterly office hours that are hosted by EHP and BCMAC, which you are all attending, so you are all aware of that outreach. So we first want to take a look at we want to take a look at kind of what the lay of the land is. So Beaver County emitters and monitors, to show roughly where these monitors are located. As you can see, there are 9 either current or future Title V permanent facilities or major source facilities that are located at varying places throughout the county. We have 5 AeroQual monitors, which are going to be those blue diamonds. And you can see the names of those from the townships that or the towns that they are located in. And then you can see that there are 3 PADEP monitors that are located in the area as well. One of them is co-located with AeroQual Monitor C, or the one that is in Beaver Borough. And they test for various different pollutants. Not all of them test for the same pollutants that are going to be touched upon in this report and in this project. You can also see that there are a number of minor source facilities, and those are facilities that do not meet that major source criteria. But that does not mean that they are small sources. That just means for their emission thresholds. So for the community in Beaver County, at the last census, the population of Beaver County was about almost 170,000. And then we wanted to look and see some of the vulnerable populations, because some of the AQI standards call out different vulnerable populations as being more sensitive and being more affected by some air quality concerns, especially the AQI has good, moderate, and then unhealthy for vulnerable populations. So that's one of the reasons why we wanted to look and see some people who might be more affected. That includes people over the age of 64, which is about 25% of residents in Beaver County. And then those with some chronic illness rates. That includes asthma among adults, which Beaver County is in the 74th percentile. Those living with COPD, which is in the 69th percentile, also kind of high blood pressure, which is in the 71st percentile, high cholesterol, which is in the 85th percentile, and then cancer, which is in the 96th percentile for non-skin cancers. I'm just checking in on the chat. Thank you, Hillary. I love those definitions that are going into the chat for that. So, all right, so now we're going to dive into some of the monitoring results. So again, the second quarter of monitoring is going to be from March of this year to June of this year. And the first thing that we're going to look at is going to be for PM 2.5. This is going to be our 24-hour rolling average. One of the things that you can see is that for that rolling average, most of the monitors stayed together. They kind of ebb and flow. And some of the biggest things that you're able to see is that for most of this monitoring period, the PM 2.5 range was in the good AQI category, with some bouts that went up into that moderate category. But one thing to keep in mind is that for like EPA standards, which use a 24-hour average, the PM 2.5 levels stayed under the 35 micrograms per cubic meter. So it was better or met the standard for the EPA. Right. And then we can see with a comparison to these standards, looking at the 90th percentile for those 24-hour average readings, overall, we saw that it was about 14% or less than half of that EPA standard. We can see that the highest was in Center Township, which we will touch upon a little bit later. But you might see that the Brighton Township monitor was almost half of all the other monitors. One reason we believe is that there was some technical difficulties that did not allow the monitor to function for full days at a time or continuously and kind of cut out. So that may have affected those readings. The same thing with the average of all readings. We can see that we are uh, much quite a bit lower than those EPA standards. The average of all readings is comparable to what would be the annual standard, which is 9 micrograms per cubic meter, which was recently lowered by the EPA. But this is just looking at 91 days out of a year. So it is good to see that those are lower, but a more comparable um, set of data is going to be once we reach the 1 year mark and have 365 days of data from these monitors. Cool. Apologies. Um, So the other thing that that Environmental Health Project likes to do in order to look and kind of see what is going on is look at 15-minute rolling averages. One of the reasons that we believe 15-minute averages are important is because they can show some local high high readings that can produce health effects for individuals that are exposed to these high readings. And these high readings can get averaged out over the time for those 24-hour rolling averages. So as you can see, the highest reading that we have here is going over 140 micrograms per cubic meter, which is much larger than what we would be seeing for those 24-hour averages. That one that you see kind of in the middle of your screen is from Center Township. Like I said, we would touch upon it a little bit later, and that is much higher than you would see on the 24-hour and almost double what you see on the next highest reading here. We tried to look and see kind of what might what may have caused this spike. Since there is only one, it doesn't really like come up and come down. So it things as we talked with our team, it may have been an idling truck that was very close to the monitor. It may have been a fire that happened very quickly that someone was doing and it blew right into the monitor. But as you can see, some of those higher readings and those higher uh, exposures can happen very quickly, and that you can still have those negative health effects from even those small 15-minute exposures. So that's one reason why we like to look and see kind of what those 15-minute averages look like for those health effects. The other thing that we did last time and we did this time for this monitoring period was look at the air quality index for 15-minute averages. So as you saw with those spikes, we wanted to see the days with the highest reaching AQI value. So if at one point you saw that 140 micrograms per cubic meter, that was that would put it in probably the unhealthy or very unhealthy range. Um, that would trigger to say that that was the highest AQI value that was reached for a monitor on that one day. So that would probably be the one very unhealthy that we are seeing there. In order just to see how those micro events, those smaller spikes can affect people's health because people are because people would be exposed to those higher levels of pollution. So even though we saw that all of um, the monitors met the 35 micrograms per cubic meter, we can see and that during the 24-hour readings, most of those readings stayed in the good range. We can see that of the 91 days, at one point during the day, at one point um, during those 91 days, um, 67 of them 67 of the monitors had one monitor or more that reached that moderate range, if that makes sense. And then we had six in that unhealthy range, six in that very unhealthy range, and six in the unhealthy for sensitive individuals, six in the unhealthy range, and then one in that very unhealthy range. But only 11 when all the monitors stayed in that good range. So with the way that that output was yeah, so Joel with the orange and the red days, I cannot actually pull out right now when those orange and red days did occur. I am just seeing when the monitors kind of reach those days, but I can definitely pull that out and see if I can get you an answer if they overlapped with that moving forward. Right. All right, so we're going to move on to the nitrogen dioxide. So that is the um, l- that can be used to trace all nitrogen oxides, which is a major component of smoke, or sorry, smog. And the way that the EPA looks at nitrogen dioxide is read on an 1 hour average monitoring period, as you can see here. Um, just like the PM 2.5 levels, these green, yellow, and orange are going to show your AQI values, and you can see that the AQI stayed within that good value for nitrogen dioxide for the entire time for this monitoring period. The EPA level for this 1 hour average is going to be at that 100. So you can see that for the what the EPA would be looking at, um, these levels were not reaching even close to where those levels would be. And then looking at the EPA standards, as you can see, overall, the average was about 34.7 for those 1 hour maximum readings. Again, they're not really close to that 100 parts per billion. And then for the average, which again is going to be more comparable for the year, we're at 5.75, which is not very close to the 53 parts per billion for the nitrogen dioxide. Again, we're going to kind of zoom in and look at those 15-minute averages. You can see that the levels do get bigger once we look at a smaller scale uh, for some of those spike pollution events. That could still negatively affect people's health, cause asthma or other respiratory issues. But again, they are not very close to those EPA levels of that 100 parts per billion, and they are still below the annual standard, which was in the 50s. Moving on to ozone. Ozone is uh, ozone is formed through secondary formation. One thing that we did see from ozone for this monitoring period was that there was a slight increase. This is going to be consistent with the change in seasons. The way that ozone is formed is through having the primary pollutants like nitrogen dioxide, um, nitrogen dioxide, VOCs, particulate matter, and other primary pollutants. They actually react with sunlight in order to form ozone or three oxygen molecules. This can help. Some of the health effects are going to be asthma exacerbation, difficulty breathing, And those in vulnerable populations are going to be more affected by this. But with the sunnier and slightly warmer days that we've been having, I know that with the rain that we just had today, it might not always feel like it. There is more ozone formation, which is consistent with seasons. But as you can see here, the EPA, we are looking at an 8-hour rolling average for ozone. Again, we have the uh, AQI imposed onto the graph. And for most days, we were seeing a good AQI for ozone with just um, a few jumps into that moderate range. But none of those went above the EPA daily maximum standard. And then again, if we're looking at the EPA standards for ozone, we're looking at the 8-hour daily maximum average. So that is going to be taking 8 continuous hours and taking the average of those. That is what is used in order to determine the EPA levels, and then compare that to the standard. So for EPA, we're looking at 70 parts per billion. For ozone, uh, we are at about in the 60s. Center Township had a little bit more ozone for its highest average, but then we are taking the second, third, and fourth highest values. The reasons for that is that for each year, um, their exceedances can happen for up to 3 days. Once the fourth day would happen according to the EPA standard, the monitor would be out of compliance for that year, and then out of compliance would be determined once that might happen for 3 years in a row. But that is the reason why we are looking at that 8-hour average when comparing to the EPA standards. Right. But again, this is a slight increase from what we saw last time, and that is because we are heading into those warmer months with a little bit more intense sunlight during the day. Zooming into our 15-minute averages, again, as we can see, we do have a slight increase, but none of those 15-minute averages are hitting above that 70 parts per billion for the ozone levels. And these are going to oscillate kind of throughout the day as well, just because sunlight is more intense in the early to mid-afternoon. So there is a little bit, you can kind of see a little bit of an undulation with each day as it moves through the graph. All right. And finally, moving on to our total VOCs. Again, we are looking just at the number of VOCs that are in the air. VOCs can be a whole bunch of different compounds, and depending on the type of, and we are just looking at those levels. Uh, Depending on the type of compound is going to determine what those health effects are. Generally, they are going to affect um, the respiratory system, have more effect on people with asthma, COPD, or those with those vulnerable populations with if that might already have difficulty breathing. But as we can see for the 24-hour rolling averages, um, all of the monitors appear to kind of stay together. This is a rolling average, so you can see that any pollution events might be moving kind of through the area, um, but the uh, but the spikes are happening roughly at about the same time at different levels. So we believe that this might be due to weather conditions, or other larger kind of regional sources that might be affecting the monitors and might be affecting those VOC levels. Looking at the total VOCs, as you can see here, the average of all of the levels is going to be about 8 parts per billion. One thing that you will notice here is that there is no EPA standard because due to the varying nature of and varying health effects of VOCs. There is not a NAAQS or an EPA standard for what is an exceedance in total VOCs. That is going to be determined based off of what VOCs are emitted and what those emission limits are based off of different facilities. But as we can see, these levels are going to be roughly hovering around kind of like that, kind of the same area. So there's rough homogeneous to the levels that are across the county. And then with the average of all readings, these are going to be on the lower end of the spectrum, again, with the average being a little less than 1 per billion for this period. When we zoom into the 15-minute averages, again, what we can see is that there are some events and there are some spikes that are a little concerning. We have one spike here that is reaching almost 90 parts per billion. These can have, again, quick, uh, these spikes can still have health effects for people. Uh, these spikes can have health effects for those that do experience these pollution events. And just because they are happening very quickly does not mean that they are, you know, not going to have negative health effects. Um, Joel, I would have to look and see with the Cardinal power plant. That is not something that has been on my radar, but I can definitely kind of dig a little bit more and kind of see if we believe that that might be something that might be affecting um, some of the levels. All right. So looking at the conclusions of the report, Beaver County air pollution levels were modest during this period with short-term spikes of particulate matter and VOCs. This data points to regional sources of PM 2.5 and nitrogen dioxide. And one of the things that we saw when we looked at some of the wind analysis, it pointed to more localized sources of VOCs and more ozone formation across the region, which is likely due to the season. For PM 2.5, we saw that all monitors met the 24-hour EPA standard, which is that 35 micrograms per cubic meter. We saw high but infrequent short-term exposures or spikes that lasted for 15 minutes or more, and these could induce health effects for some of those sensitive groups. From our source analysis, it indicated that regional sources of PM 2.5 were coming from the direction of the city of Pittsburgh, or kind of coming down the river valley from the city of Pittsburgh, which there are a bunch of different sources that could be in line from there. For nitrogen dioxide, the readings were well below the EPA standard of 100 parts per billion, with the highest daily max for 1 hour readings being 39 parts per billion. The highest NO2 readings were at monitors that were more urban areas during calm winds, which indicates local pollution sources such as vehicles or other industrial facilities that might be close or nearby to the area. Then for ozone, as I said, ozone levels increased since the last monitoring period, but they still met the EPA standard of 70 parts per billion for the highest 8-hour average daily maximum. Increased levels in ozone are consistent with seasonal changes in ozone formation, which increases with sunnier days. For the VOCs, the total VOC levels were generally low across the monitoring network with several high short-term spikes. And the highest levels of VOCs were recorded during low winds, which may indicate some local sources for those VOCs. All right. So before we move on, I'm just going to quickly open it up just to see if anyone has any questions that they would like to share, just to kind of take that information in. Taking a look at the chat.
While
Right.
folks think on questions, I will just say Joel had brought up facilities in Ohio that could be affecting our air quality. One thing that we do believe could affect Beaver County air quality and water quality is the Arkwood Environmental incineration plant. This used to be called Heritage Thermal. I don't know how they pivot to a word with environmental in it, but we have found out that that plant burns more PFAS than any plant in the United States. And that sits directly on the border and would affect PA, Ohio, and West Virginia. It sits right on that corner. So that's something we're looking more into. We do recognize that plants do not recognize state borders or county borders or mile radius. So I just want to make sure everyone knows that's on our radar and we are monitoring that.
Yeah. Also, I would like to say that for some of like the ozone formation, especially since it's secondary, if you want to look at the report, some of the places where we believe that primary pollutants may be coming from are going to be greater regional sources, which might be coming from eastern Ohio. So that definitely could be something that could be affecting some of these levels as well. We've been able to identify possible local sources of high VOCs. Um, so one Hillary, I don't know if you have anything that you would think for high levels of VOCs that could for facilities that you might think about.
Yeah, I mean, that's a great question. I saw that one come in and I was kind of debating, but we're under zero, excuse me one second. We're under zero obligation to you know, protect any type of facility, but we are under a certain type of obligation with our funding streams to say, like, we're going to work to identify any industrial polluters that could be harming the community. So there is a paint plant facility not far from where we have our monitor located. I don't want to say the name. I don't want to give away the location either, but I do want to say, like, yeah, we have concerns about a lot of locations in Beaver County. And Aaron, I think you opened this up by saying, how many facilities in Beaver County have a Title V, or I read that in the report. So I think it's like 8. And just knowing that, was it 8? 6? I can't remember.
There are 9, so
Oh, okay.
including the one that is coming this summer. There would be 9 total fit the major source facility. But I think
Okay.
there are 45 or 47 minor source facilities, if I remember correctly.
Okay, that's good to know. And so maybe we should talk a little bit about that, like what that means. Like the 9 major source facilities means that there's that number of facilities that are required to have what's called a Title V permit application. And this just means all of their air permits that they have obtained through the DEP are located in one giant document. It's all related to air quality. So yes, we definitely, I mean, and that's no secret, right? Like we all know these facilities exist. We all know that there are large polluters. A big part of this project is information and awareness, and that's really what we're trying to push right now, without mentioning any names and without saying, yes, we feel certain that it's one facility. We do need to keep in mind that there are all of those minor polluters in and around the area, as well as the 9 major facilities. I hope that clears things up a little bit.
Yeah. Also, there was a question about an event that occurred at the Shell facility. This report was completed before that event had occurred, but we will definitely look within that timeline within the next at the next period, and if we do see anything. All right, these are great questions. Thank you all. All right. So I'm going to move on to just some quick ways that you can protect your health. Just so that way we are providing, benefit to people and not just providing just data information. So one of the things to protect your health when you are thinking about air, since this is an air report, is to pay attention to your weather and air quality forecasts. You can do that by looking at airnow.gov, which is going to look at those regulatory monitors. Um, and there's an app that you can get on your phone in order to find what is going to be forecasted, the AQI for that day. Again, we have that good, moderate, unhealthy for sensitive individuals, unhealthy, very unhealthy, and hazardous levels for the AQI levels. You want to make sure to keep windows closed at night, just because that is when the air is most stagnant. Use an air purifier. Environmental Health Project recommends the Austin Air Health Mate, but reducing outdoor contaminants in indoor spaces, or ROCKUS, also offers a DIY low-cost fan filter that can help remove particles in the air as well. And we also recommend avoiding indoor air pollutants. We have a full list of recommendations on our website at www.environmentalhealthproject.org/air. And we also recommend vacuuming instead of sweeping to reduce airborne particles that are kicked up in that sweeping process. And make sure to try and use a HEPA filter on your vacuum so that things are, again, not recirculated into the air, causing any distress or any aggravation of air breathing symptoms. Other tools that you can use to check air quality, since again, with this project, as we talked about at the beginning, you can go to BC Mac's website and Eyes on Air, and you will see real-time monitoring results for all of the pollutants that we are monitoring in real time from each of the monitors. You can also go to Purple Air. There are a bunch of Purple Air monitors that are being deployed throughout the county where you can see real-time air monitoring and see one that might be more local um, to your home. And again, you can also look at airnow.gov, or there is a phone app that you can use as well. So for
Erin, can
protecting
I
your health,
just, I did
go
have
for
a
it.
question that came in via DM. It
Yep.
was, are VOCs less likely to be detected during higher winds in general? From my understanding, that would be true. There's higher winds. The phrase dilution is the solution is what I've heard, but I'll let you take that one.
Yeah. So are they less detect? I mean, so the because of the particles, because the sampling method, it would have to get to it. So if you have, like VOCs are super varying. So if you were to spray like a lot of perfumes or some cleaning products have VOCs in them, they talk about getting fans in to kind of move it around and get it out of there. But if you have, so I believe the answer to that question would be yes. But it also kind of depends on the concentration. There's also a few other things that might end up happening as well, because as we said, they can kind of uh, transform through that secondary formation into things like ozone as well. So I believe the short answer would be yes to that question. Does that help?
It does, Aaron. Thank you.
Okay. All right. One of the other ways too that I wanted to jump back to checking your health, thinking about drinking water. So in your home, a lot of people might be concerned about their drinking water. If you have a public utility, make sure to look for your provider's consumer confidence report, which should be on their website. But if it is not on their website, you should be able to request it from your provider if it's not listed. You can also search for water quality information by your zip code at the link in the presentation, which I'll make sure to get that out if it is not clickable. Uh, and then if you have well water, the PA Department of Environmental Protection has well water resources in order to what to test for, how often to test for, which they recommend, I believe, annually, as well as certified labs. There is also private well testing that may be available through Duquesne University upon request. If you have any questions about that, please feel free to reach out to me after this presentation, and we can definitely get you connected. But if you have any significant concerns about your water, we recommend to avoid using it for drinking, cooking, baby formula, or or just general drinks. That includes smell, taste, or odors. If you have any, if you have any of those concerns. Mhm. And then for protecting your health from surface water, so recreation, we have a bunch of rivers and a bunch of water recreation uh, that can happen in our area. So for outdoors, recommendations from Three Rivers Waterkeeper are to stay away from obvious outfalls because this is where pollution tends to concentrate. Um, Avoid contact with water during or immediately following rain events to prevent contact with bacteria such as E. coli from sewer overflows into the waterways because of combined sewer overflows. And then for more information regarding water uh, in the area, you can go to threeriverswaterkeeper.org, and they have a PFAS report, a swim guide report, and then they also have a real-time water quality monitor buoy in the Beaver River at the link below. So I'll pause a little bit so that way if you want to take that link down, unless, yeah. All right, nope. Okay. All right. And then finally, with protecting your health, one of the things that Environmental Health Project recommends is if you have concerns about something that is going on, if you have symptoms that are reoccurring, to keep a health diary. That includes having the date, having the time, noting your symptoms that you believe are occurring, such as nosebleeds, headaches, breathing problems, skin irritations. Pictures can also help document that, as well as weather conditions and any other environmental conditions. You know, what was the air like? Was it dusty? Were there odors? If you believe water might, there might be issues with the water, color, taste, odor, and then anything that else that might be going on with industrial activity. So if there is a fracking pad, or if there are other infrastructure, noting those and see. So that way, if you when you reach out to a health professional, you are able to provide a lot more information, and they would be able to help find a solution. And finally, we have a whole bunch of resources of handouts. We have a quick reference health reporting card, protecting your health, tips for talking to your healthcare provider, all potential health effects due to inhalation of different chemicals, which most are VOCs on that handout, as well as illustrated stages of shale gas development. And then we have an event reporting form um, as well, all located on our website. I apologize, I'm in a little bit of a different setup this evening, but I will be able to make sure that those links go to those who have registered for this event. And if you have any other questions, please feel free to reach out to us. Our website is www.environmentalhealthproject.org. Our phone number is on the screen, as well as my personal email contact. So if you have any questions about the report or anything else, please feel free to reach out. I'm always willing to take the time.
Thanks, Aaron. We really appreciate you. Just
And Ned, oh, one more
yeah,
thing I was gonna say, and Ned has a good thing in the chat. Just if you are experiencing a health emergency, please dial 911 or go to the closest emergency department immediately. Thanks for that, Ned.
thank you. Thanks so much, Aaron. We sincerely appreciate all the work that you put in on this report. It's super valuable. Just to answer some of the questions that you had as you went through your presentation about our mobile monitors that we have. So we are going to launch our mobile air monitors. It will monitor two different compounds. The first one is 1,3-butadiene. As you had stated, the second one is benzene, but they can't operate at the same time. So what we're going to do is for the first 6 months, we'll probably monitor benzene, and then we're going to move over and monitor 1,3-butadiene or vice versa. We've just encountered some problems when it comes to the solar panels. We're still trying to figure out how to move the monitor with the solar panels on it with the gate closed. We're running into a huge issue. So once we figure that out, we've got everything up and ready to go. And we've already started a sign up sheet. I am sure Hillary Flint has put that in the chat, and if she hasn't, she will place it in the chat for us. But the plan is to drop the air monitor in your driveway or on the side of your street, leave it there for 2 weeks. It is completely self-sufficient. You won't need to do a single thing, and the results are transmitted via cellular data, so we don't have to come out, touch it, do anything. It is completely autonomous. And the second piece, I believe we answered it. So we were talking about the several high short-term spikes of the VOCs in the area. So we did address that. Are there any other questions for Aaron or any of the experts that we have here with us this evening? Dr. Ned Katire is the president of the Physicians for Social Responsibility for the state of Pennsylvania. His work is very valuable as well. Not to put you on the spot.
I'm here if you have any questions. Thanks, Hillary.
Thank you. Well, okay. If not, I just want to remind everyone that the quickest way to stay in touch with us is to follow us on social media. You can sign up for our mailing list, attend events in person and or online. And you can also mark our website, mark it as a favorite, keep tabs, make sure you check in, look at the air quality in any of the 5 locations where we have our monitors throughout the county, so that you can stay informed about the air quality. And Hillary Flint has dropped all of our Facebook, Instagram, Linktree, mailing list, all of our links, all of those important links that will connect you to us in the chat already. So make sure that if you're not signed up for one of those, you click in there and get signed up. So thank you all again for being here with us today. We honestly couldn't do this work without you. And for those experts, including Aaron and Dr. Katire, thank you. Thank you all so much for the work that you do. And Aaron, thank you for bringing us this information and for taking the time to meet with our community today.
Before we go, Hillary, I have one question to answer that was in the chat, which was if there's a type of doctor you would recommend speaking to if we have health issues. And the answer to that is, well, number one, we're going to be trying to educate doctors in Beaver County so that people don't have to go too far. But in the meantime, going through the East Palestine train derailment, I will say I was connected with some different specialists. And so they are aware of what's going on in Beaver County and in East Palestine, Ohio. And that is a toxicologist. So there is a toxicologist at UPMC. We can't give out medical advice, but I can tell you this is who was the person that everyone was referred to after the train derailment. So I will drop that department in the chat. And, even if you just reach out to ask them questions, I think that would be a good step.
Thanks, Hillary.
Hillary, if I could just add that I think if anyone is concerned about health symptoms that you're having, you should reach out first to your primary care provider. If it's your child that's having symptoms, reach out to your child's pediatrician first. They're the people who are most accessible to you. They know you, they know your family, and if they have any questions, they can certainly contact us at EHP, and we can talk to them and give them further guidance. But the first place they should check is with their primary care provider.
Great. That's so valuable, Dr. Katire. Thank you so much. Thank you. Okay. Well, if there are no other questions, thank you again, and we will see you all soon. Take care.
Thanks all.
Thanks, Aaron.